Hi everyone, my name is Megan, and today I'll be talking to you about deafness and hard of hearing students and how their disability might affect them in our classrooms. The Individuals with Disabilities of Education Act defines hearing impairment and deafness as two separate categories that students can receive special education services or other related services for their disability. So as you can see here, hearing impairment is an impairment whether it's permanent or changing over time that adversely affects a child's educational performance. So these students can respond to auditory stimuli sometimes depending on the severity of their hearing loss. Meanwhile, deafness by IDEA is defined as a hearing impairment that is so severe that the student's linguistic processing has been affected, and these students cannot hear or are prevented from hearing sound in any or most of its forms. There are actually two versions of deaf that we should be aware of as school counselors, because the way a student's family might prescribe to their child's deafness or hearing loss might affect how they want their child to be accommodated in the classroom, such as if the student receives an ASL or American Sign Language interpreter in the classroom with them. So there's big D or cultural deaf and little d medical deaf. Big D or cultural deaf includes those individuals who embrace their deafness and view it as a strength. They're also more likely to utilize American Sign Language in their everyday lives, while those who define themselves as having little d deafness only view their deafness as a medical diagnosis only, and they typically view their deafness as a limitation or a weakness. Although hearing loss is a low incidence disability due to the very low number of students who are affected by hearing loss, there are still over 24,000 children born each year in the U.S. with this disability. In New Jersey alone, only 0.12% of students in 2012 had a hearing impairment and received special education services for it. There's also some diversity in deafness. Although the majority of individuals who are affected by hearing loss or deafness are over 65, there are still children affected. It's interesting to note that boys are more likely to have hearing loss or deafness than girls are. In New Jersey, there is a little bit of diversity in deafness in that over half of those students in 2012 with deafness or were hard of hearing were white, a quarter were Latino, 13% were black, and 8% were Asian. It's also interesting to note that the higher someone's socioeconomic status is, the more likely he or she will experience some sort of hearing loss or deafness throughout their lifetime. There are a few different types of hearing loss that we should be aware of as school counselors. The first is prelingual hearing loss, which is when someone loses their ability to hear before they begin to speak. There's also postlingual hearing loss, which is when someone loses their hearing after they have gained the ability to speak to others via a spoken language. There's also unilateral hearing loss, which is when you lose your hearing in one ear, and bilateral when it is lost in both ears. There are also a few different types of hearing loss that differ based upon the place within the ear that it has damage. So conductive hearing loss is when the hearing loss is due to damage in the outer or the middle part of the ear. This sort of hearing loss is more likely to be treated and result in total or partial improvement of hearing. There's also sensorineural hearing loss, which is more severe and more permanent due to the fact that the damage is located within the inner ear or the cochlea part of the ear. This damage typically occurs as we age, which is why the majority of people with hearing loss are older. However, this can occur in children due to head trauma, chronic ear infections, or other diseases. The last type of hearing loss is mixed hearing loss, which is just a combination of damage to the inner and the outer part of the ear. There are congenital and acquired causes for hearing loss. They may differ based upon whether the hearing loss is conductive or sensorineural, but in general, I'll just go over a few. Some genetic or congenital causes might be due to complications in the pregnancy or the birth if the mother uses drugs throughout her pregnancy. Might also be due to a family history of deafness or hearing loss as well. So if a person's grandfather and his father both had hearing loss, the child is more likely to have it as well. Some acquired causes include succumbing to some diseases or having diseases like mumps, meningitis, measles, chickenpox, even some types of cancers, and especially chronic ear infections. It can also be due to simply such as wax in the ear, exposure to very loud and excessive noise, drug use and aging, or chronic otitis media, which is when there is a buildup of fluid in the ear, which commonly occurs for kids. Some signs for hearing loss that we should be aware of as counselors include things like if a student has a severe language delay or difficulty articulating themselves, whether it's to you one-on-one or in front of a group of peers. If a student does not respond consistently to sounds or even their name, that might be a sign that the student is having some trouble hearing you. The student, if they have some hearing loss, they might be easily frustrated or inattentive in the classroom, and this generally leads to some behavioral problems in the classroom as well, which might be the reason why a teacher sends a student to us in the first place to rectify those behavioral issues, but really the underlying cause might be some type of deafness or hearing loss. And lastly is if a student is reported by his parent or her parent to turn the volume up on the TV extremely loud. Teachers might also see this in the classroom if students turn up the volume on their Chromebooks or iPads that they use in class as well. There is a continuum of hearing loss or hearing in general that goes from normal hearing to profound hearing loss and then deafness also. In general, hearing loss is when you can't hear something if it's not at 30 decibels or higher. So decibel is the range of how loud something is. So 30 decibels might be something like a whisper or a humming refrigerator, and if you can't hear that, then that means that you have some type of minimal or mild hearing loss. So for those with mild hearing loss, it's generally easier for them to communicate with others one-on-one rather than a big group setting. So this might go more so unnoticed than profound hearing loss in our classrooms. For moderate hearing loss, this is when someone can't hear or process very clearly normal conversations. So the way that I'm speaking to you now, a student won't be able to understand or even hear that. For severe hearing loss, these individuals can't hear sounds unless there are 70 decibels or 90 decibels in loudness. So that means that they can't hear something unless it is loud as a hairdryer or a vacuum. Those with profound hearing loss can't hear things over 90 decibels, things unless they're 90 decibels loud. So something like a motorcycle that is 20 feet away. Also, deafness is when someone cannot hear sounds in any type of capacity. So these types of hearing loss have impacts on learning in the classroom, such as affecting the social development and friendship development students might have, especially in our elementary schools. Hard of hearing or deaf children might not participate in cooperative or group play opportunities as much simply because they can't hear or communicate as well. Deaf and hard of hearing students are typically of average cognitive ability and intelligence. The most severely effective type of learning is speech and language, especially because they have a difficult time learning grammar, sentence structure, and reading and writing are very difficult as well. So their educational achievement is delayed when compared to their hearing peers, especially when their hearing loss goes undiagnosed for a lengthy period of time. Due to the impact on learning that hearing loss and deafness can have on our students, there are various accommodations and modifications that we can use in students' IEPs to help them learn better. And these accommodations or modifications should be based on the student's unique learning needs and also the severity of their hearing loss that they have. The earlier we're able to accommodate the student's needs in the classroom, the earlier we'll be able to close the educational gap between him or her and their peers in the classroom. Some communication accommodations that we can help to implement include having teachers making it easier for students to speech read or lip read by things such as simply not covering our mouths when we talk, trimming any facial hair, or not chewing gum or eating while teachers teach a lesson, or even when we go into classrooms and teach lessons. We can also provide students with specialized seating arrangements. This doesn't necessarily mean that they sit in the front of the classroom, but closer to the point of instruction, so wherever the teacher is at the most in the class, the student should be sitting near them. Teachers can also obtain the student's attention prior to speaking to him or her, always presenting material in simple, clear ways and doing it slowly so the students can process and understand what is going on. And also, of course, using a lot of nonverbal cues and visual aids to help gain the student's attention and help them to understand their instructions as well. Some instructional accommodations and modifications that we can help teachers implement in the classroom include creating a buddy system for our deaf or hard of hearing student, and their buddy can help them to take notes and provide an extra support in the classroom when the teacher can't always be with that student. We can also have teachers provide step-by-step instructions for our students, in addition to captioning all of our videos and using other assistive technology. Now, assistive technology can include things like computers, watches that have flashing lights or vibrations on them so that students can be alerted if there's a lockdown or a fire drill. They'll know what's happening. And also telecommunication devices where students can type into an iPad or computer and the computer will read out loud what the student just typed so others can hear it. There are also curricular accommodations or modifications, which include modifying reading and writing assignments so that they are shorter or easier to understand, more on grade level rather than being extremely advanced. It might also include having extra practice or pre-teaching the student before a lesson one-on-one, so that way the student has extra time to process the content. And lastly, we can expand the curriculum to include things like teaching the student self-advocacy, listening skills, and also having them participate in American Sign Language lessons to help them learn another way of communication. Lastly, there are some other modifications that we can incorporate as well. The most expensive would probably be changing the physical environment of the classroom that the student is in. So this would include changing the walls and carpets to sound-absorbing material to make it easier for the student to hear. The student, based upon the severity of his or her hearing loss, might utilize some type of amplification tool like a cochlear implant, a hearing aid, or an FM radio device to help amplify their hearing. And there also might be evaluation accommodations where you reduce the number of tests a student has. You might read out loud questions to them, help them answer, or put them in a quiet place for their tests and assessments. Lastly, what can we do as school counselors to help our deaf or hard of hearing students? We definitely have to collaborate with the parents and the guardians of the students as well as the teachers. When we collaborate with the teachers, it will be mostly to help make sure that they are accommodating the students' needs in the best ways they can in the classroom. We can also collaborate and consult with community members or members of the deaf community to educate not only ourselves, but also help to educate the families of these students and provide them with all the resources that they need in order to help their students succeed. Now, if you have any questions, you could just ask me and I'll answer them the best that I can. I'm also going to post an IEP checklist for deaf and hard of hearing students so you could look at more information.